Welcome to Medicaid Matters, the only live talk show about the business of Medicaid healthcare. And now, here's the host of Medicaid Matters, Richard Yadon.
And thank you, Braley, and welcome again to this edition of Medicaid Matters. I'll be your host for the next hour as we explore the issues of Medicaid Data and MMIS and talk a little bit about the conference we were at a couple of weeks ago, the Medicaid Enterprise Systems Conference. This is Richard Yadon, President and CEO of Managed Medicaid Services, and I'll be your host for the next hour. We're going to bring this show, as you know, to the Medicaid community every other Tuesday at 1 p.m. Eastern Time, unless we're at a special off-site event or something of that nature, which incidentally, as I mentioned earlier, that's exactly where we were 2 weeks ago, broadcasting live from the Medicaid Enterprise Systems Conference in Boston. If you did join us during that show, first let me say that if you were able to persist throughout the entire 2 hours, then you know that we had some technical issues with our audio. So first of all, thanks for hanging in there with us during that show. And this is something that happens occasionally with remote shows. We really have no control over the venue. And I don't know what those issues were really being caused by. We had a group trying to troubleshoot things for quite a while. But I don't want those issues to in any way reflect on the quality of that conference. In fact, I'm going to spend a few minutes here and tell you about some of the trends that came out of that conference that we observed at our time there. And also, our technical problems there were specific to that venue, not the conference itself, and especially not to the any of the conference organizers. They did a fantastic job putting together a conference Sunday through Wednesday. If any of you have been involved in doing something like that, then you know how difficult it is to put something together. I can only say that they went above and beyond to sponsor our show. So we're going to try to clean up some of that audio that we had a couple of weeks ago if we can, and you'll certainly be able to tune in and hear that show in our archives. We had some fantastic guests across the entire spectrum of MMIS, and it's a shame that we had those problems, but I think we'll be able to get some of those cleared up and do something about that. Well, okay, if you are new to Medicaid Matters, then you need to know that we're an interactive show. Just as you hear on talk radio, that's what we do here. We can take your calls. You can be a part of the show. You can talk to us. And especially if you were at the MESC conference, the Medicaid Enterprise Systems Conference this past couple of weeks, we'd love to hear from you on the show because we are going to talk about that. And then we have a rather detailed discussion that we're going to play for you that was pre-recorded that I think you're going to get a lot of out of as well. But being interactive, that does mean you can be a part of the show. You can join us by phone. You can join us by Twitter. You can chat right online at MedicaidTalk.com if you're there. So we're ready for any of your calls now. The number is 626-657-2125. That's 626-657-2125. If you can't call, we're on Twitter. You can send comments or a question to @MedicaidTalk, and we'll get them on the air as time permits. And finally, you can join a live chat that's going on right now on the MedicaidTalk.com page. Just join us there, and we'll read your comments and questions on the air as time permits and it's appropriate. Well, I don't know, before we jump into this, I wanted to mention to you there's a great article in the New York Times on Friday, August 31st. It's online if you want to get to it. The article is entitled, "Two Campaigns Differ Sharply on Medicaid, Seeking Vast Growth or Vast Cuts." And it really is it's a quick read, but I think it does a reasonably good job of giving you a very broad outline of what the two presidential campaigns are saying about Medicaid. Let me just read a few things from it so you'll get a sense of what it's like. It says a few other issues present a starker difference between the Republican and Democratic tickets talking about how to handle Medicaid. In pure dollar terms, the difference comes down to this. As chairman of the House Budget Committee, Mr. Ryan has proposed cutting federal spending on Medicaid by $810 billion over 10 years, largely from repealing the health care law, Affordable Care Act. Mr. Obama's expansion plan, by contrast, would cost an additional $642 billion over that same period, and this is according to the most recent estimate from the Congressional Budget Office. Proponents of the Republican plan for Medicaid say block grants would be the best way to curb Medicaid spending and make the program more efficient. Says Governor Rick Scott of Florida, a Republican, you give me a block grant, let me do whatever I want, and I will cover the right people. That was a comment he made at the National Governors Association last year. But critics of the block grant plan say it would inevitably shrink the medical safety net for the poorest Americans. The Urban Institute, a nonpartisan research group, estimates that under a similar House budget proposal last year, 14 to 27 million could lose Medicaid coverage by 2021. Now, Joshua Archibald, who is a director of healthcare policy at the Pioneer Institute, which is a conservative research group in Boston, said that while block grants were, quote, one possible tool to curb spending and root out waste in Medicaid, many questions remain about the Republican proposal that need to be answered, including how the federal government would determine the amount of each state's block grant. Well, I guess the good news out of all of this for those of us in Medicaid, and we've known this for a long time, is that change does need to come in some way or some fashion. Perhaps this is what we can take away from this election, and the fact that the right people seem to be on board now with looking at doing things a new way, something I think the Medicaid community has been talking about for a long, long time. Mr. Archibald also says Congressman Ryan's plan moves the conversation in the right direction to correct the perverse incentives that have put Medicaid on an unsustainable path. But the devil's in the details, and isn't that the truth? A lot's going to be said, I know, over the next several months as the election swings into higher gear. We just finished the RNC convention, the DNC convention's kicked off, so you're going to hear a lot about this. We seem to hear a whole lot more about Medicare and what one side would do versus the other side with respect to Medicare, but not a whole lot about Medicaid, and maybe that's because the Medicare population is a more engaged voter bloc than you would otherwise get out of the Medicaid population. I don't know, just my perception, and that might be why we're hearing it. But if you're at all active on Twitter, if you're all active on Facebook or Google Plus or any of the social media, there is a lot going back and forth about what could or could not happen with Medicaid, and who knows? Who knows what's really going to happen? The good thing, though, out of this, I think, is that the conversation has been elevated to the highest levels, and there are organizations that are engaging the people in the business that know what's going on, that to have a say in that. So good things coming, no doubt. One way or the other, we're going to see some change. Well, while we were at the Medicaid Enterprise Systems Conference, it was a couple of weeks ago, we had a chance to catch up with a number of friends. We got to meet some new ones, and I want to say thanks to all the listeners who did come by our broadcast to meet us. We really appreciate the feedback that you give us. And really, the opportunity to meet you personally is a very significant treat for me, because I do get comments, so on and so forth, but the chance to talk with some of our listeners and viewers personally was a real nice thing to be able to do. If you do have comments, we read them all. You can do them right there on the MedicaidTalk.com page, just right down below the video screen. You can leave a comment about this show or any show. Certainly open to hearing your feedback. Would love to know more about where you'd like to see or topics you'd like to hear on the show going forward. The conference covered a huge range of topics, and you really had to budget your time to get it all in. There were, however, some noted trends that were popping out among the presentations at the conference, some trends that I thought might be of interest to you as well. Many of you have heard me speak about how important looking at data, how important that's becoming to meet some of the Medicaid program goals. And when you dig down into it, you realize that the goal has become one of improving the quality of health of millions who have no real ability to do it on their own, to do all that at a higher rate of satisfaction, higher quality, and at much less cost. And doing that is a tall order, but I think a lot of the tools and resources are available in MMIS data to essentially get that job done. And conferences like the Medicaid Enterprise Systems Conference and the conversation you're going to hear in just a minute may very well be on the frontier that will help us turn this corner. So here are some trends that came out of the conference, and these are coming from the very people who are on the forefront of these issues. Now, first of all, this was the largest ever gathering of professionals behind the innovations and the advancements that are driving Medicaid management information systems forward across the country. It was a one-of-a-kind event, and being one of the only events in which representatives from CMS, from state government, from health plans, from the vendor community, all collaborated in presentations. There were task groups, there were panel discussions. And during the 4 days that the conference was in session, it seems like the emphasis fell into three key areas: health insurance exchanges, provider payment reform, and claims processing. And there were also groups that held their board meetings at the events, groups which some of you may be a part of, the Private Systems Technology Group, or the PSTG, and the Systems Technical Advisory Group, the S-TAG. Were both there having board meetings and had a substantial part or substantial presence at the conference. These groups really, I think, demonstrate a level of commitment and cooperation being put forth by the entire Medicaid industry to drive IT innovations into the marketplace, and it was great to see that happening. Some of the key points that were made in the sessions I think are important. CMS projects that Medicaid spending will be about $536 billion in 2014, a 27% jump in 2 years' time. Provider payment reform will become a growing priority for state agencies, and every state is under tremendous pressure to contain costs while improving or maintaining quality. During the conference, purchasing ideas and strategies were discussed, including crossover claim processing, pay-for-quality incentives, reducing the use of charge-based and cost-based payment, among others at the conference were also discussed. Future success in claims management, and this was noted a number of times, will depend on the state's ability to manage the new business rules, creating executable code through automated business rules guided by legislation. That's going to lead to improved services and cost savings. Also, in 2011, CMS, of course, released the Medicaid IT supplement that was titled 7 Conditions and Standards, which calls for states to address specific federal IT standards in order to receive enhanced federal funding for future MMIS projects. Several sessions were focused on efforts towards producing and procuring modular MMIS based on MIDA and CMS standards. And in fact, during our show, we had a guest from CMS who talked about this very subject. So there was a lot going on, a lot of discussion, a lot of information. If you have not attended the Medicaid Enterprise Systems Conference, you should be there. Now, while I was at the conference and had tremendously, insightful conversations with people there, I thought back to a show that we did this past December. And on that show, my guest was Dan Rizzo, Chief Information, I'll get it out here in just a minute, Chief Innovative Officer for MedAssurant. And during our show, he talked about the multiple ways Medicaid organizations are working to put data in the driver's seat. And I thought it'd be helpful and interesting to listen to a portion of that show to give you a little bit of a perspective of what's going on today in MMIS. Now, I want you to hear all that Dan has to say, but if there's time toward the end, I'm going to jump back in with some closing thoughts. Also, the video portion of the show is going to go off just for a little bit here when Dan starts talking, but you can still listen to the audio of it, and if we have time at the end, it'll come back on when I've got a few closing thoughts. Okay, so let's listen to what Dan has to say.
To innovate and find ways to use data to drive improvement. I think you said an important thing in your intro that the discussion of data in the driver's seat is a strategic one, it's a technical one, and I would add one to that. It's an operational one because we can find insight from data, but we have to do something with it too. And I would love to talk more about that. But I think it's real excited about being here today. So thanks for having me.
Well, great, and we certainly are going to dig into that because it's very, very important. I think less so today than maybe several years ago, where the whole issue of data, what are you doing with data, how you're collecting it, was primarily a function that was within the realm of technology departments and companies, but it has just become so important today that it is very, very much part of how a company determines its strategic direction and which way it's going to go and how it's going to operate. I think you hit that right on the head when you mentioned that. Now you're the Chief Innovation Officer, which is one of the coolest titles I think I've ever come across. Tell me a little something about your role and how you are involved with Medicaid healthcare.
Sure. Well, in my role, which has evolved over the years, I've for a number of years been involved in bringing solutions to the market for our clients, really supporting our mission of innovation. So in that realm, I run a team here that focuses on understanding the evolving industry, how the world of Medicaid is changing, how the world is evolving into more managed care. Today, nearly 70% of Medicaid-eligible patients are managed through a Medicaid health plan, and really listening to what our clients need, taking the capabilities that we've built here internally at MedAssurant and pairing them together in different combinations to sometimes solve old problems in different ways and sometimes solve emerging problems for our clients. And then sometimes that means continuing to build out the capabilities that we have here that we hear a need for from our client base. So it's a very enjoyable position, being able to really see what our clients need, talk to them every day, and bring together solutions in partnership to make that change. Whether it's a financial change, whether it's how to operate more efficiently, whether it's a quality improvement change, how to make sure that a traditionally underserved patient base, the Medicaid patient base, is getting the care that they need and deserve. So it's I love my job, and it's one that I get excited about every day.
Well, I know with the wide variety of clients that you deal with, and what was it, 118 million different patients that your company's been involved with, you see a lot. You see a very broad spectrum of what companies are dealing with from a data standpoint and using that data. And you mentioned some of the emerging issues that companies are starting to deal with. What would you say are one of the top one or two emerging issues that you're finding companies are starting to really grapple with more than maybe they have in the last several years?
Sure. I think that health plans have acknowledged the need to harness data, but really are trying to figure out what that means. As our listeners here know, forever health plans have, for their very business existence, harnessed data for pricing, for actuarial calculations, for making sure that they can run a business with predictability. But what they're really struggling with is how to move down from a population level down to the individual needs of a patient in a systematic and productionalized way. We so often see situations of health plans thinking about populations, but not thinking about the individual patient, except in the silos of their case management group or a disease management area. And we need to help evolve the thought to a very patient-specific. What does this patient need now? What is the right thing to do? What is the right thing not to do at this point in time? And that's really where I think we see the emergence of need from the industry, is how to be more granular, how to gain that understanding of the individual, and then do something with that data to make a change or keep them on a path that they're already on. And that's really what we think about when we think about emerging issues in data.
Understood. Yeah, great. Well, we're actually going to have a show at the end of the month, January 31st, which is going to be focused on Medicaid care management, and I'm sure that using the data that they have available to create those care programs, to create very effective interventions, is going to be a topic on there. I don't know how it couldn't be something that's addressed on the show when we get to that. And I know you're doing a lot of work in that. We're going to talk about that a little bit later in the show, particularly the work that you've been doing with Medicaid Health Plans of America and what that looks like. We talk a lot on this show, Dan, about increasing quality, increasing efficiency through Medicaid, and a lot of data is collected by Medicaid organizations. However, it seems like a lot of that data doesn't often become information. Is this something that you're also seeing in the Medicaid industry?
I think it can be, and I think one of the reasons is that health plans are often asking the wrong questions of that data, or they're not productionalizing the use of that data, and I'll explain what I mean in both cases. In the case of asking the wrong questions, that might be unfair. They're asking questions that they've always needed to ask, but now need to ask different questions. Historically, the data has been used for, again, pricing, actuarial calculations. When we get down to patient-specific analytics, historically the industry is asking questions around cost. Who are my high-cost members? Who were they last year? Who were they going to be next year? That's important, but we would argue not as important as asking the questions, who are the patients who are compliant on their plan of care, who are indicated for services but aren't getting those services, who are likely to get services on their own and don't need an intervention, or who really needs a nudge, and what's the best way to nudge them. And I think that's really one of the key barriers to taking that data and turning it into information is really asking the right question of the data. Not necessarily, why does outcome, what is outcome X or Y, but why did outcome X or Y happen, and how can we influence that in the future? So a really important aspect of it, operationalizing it is also something that we see as critical, and that is taking those questions and really putting in programs to use the data to solve specific purposes. We always shudder to the thought of great data sitting at somebody's fingertips and then never being used in action. And so tying those two things together, I think, really can solve that challenge of turning data into information.
Well, we're going to dig into that a little bit more as we go along, but first we're going to take a couple of minutes for a break, and then we're going to hear more from MedAssurance Dan Rizzo. So stay tuned. We'll be right back.
Elevating the quality of care with less cost.
Today, that's the job of every Medicaid managed care company, but it can't be business as usual. Companies have to coordinate care a different way. The solution is Managed Medicaid Services. Through our virtual case manager network, our teams of Medicaid assessment specialists, and our new Advanced Care Transitions program, companies can dramatically raise the quality of care without increasing their cost. Visit us today at MedicaidServices.net. Managed Medicaid Services, your best source for innovative care management.
Nurses who want to stay on top of their skills know that the Nursing Informatics Learning Center is the place to go. You'll find articles, tutorials, a blog, e-zine, board-approved CE credits, links, assessments, and consultant services, all available to the global nursing community in one place. If you're a nurse or if your organization employs nurses, you need to visit the Nursing Informatics Learning Center.
By providing access to the care they need and the quality they deserve, Medicaid health plans enhance health outcomes of our nation's underserved. Listen to this letter to a Medicaid health plan that helped save the life of Juan, a 4-year-old with a rare heart disease.
All of your efforts have created a miracle for my son. Even though he was so close to death, you helped. You made a difference. Now he's coming along, little by little, step by step.
Medicaid Health Plans of America, ensuring access to better health care. Learn more at MHPA.org.
And welcome back to Medicaid Matters. This is the only live talk show about the business of Medicaid. We're here live every other Tuesday talking about the business of Medicaid health care. Hey, you know, it's getting to be the end of the year here, and already you need to start thinking about 2012 and start thinking about some of the great conferences that are available for you to attend to get more information about Medicaid health care. There's one in particular you need to get on your calendar right now, and that's the annual Medicaid Innovations Forum. It's February 8th and 9th, 2012 in Orlando. Now, this is a must-attend event for all Medicaid executives, and it's going to explore both health plans in states that are turning the challenges of reform into opportunities for innovation and growth. It'll look at how they are preparing for the expansion and the programs and initiatives that are being put into place to position themselves for success in 2014. This event focuses on next-generation strategies to expand coverage, strategies to improve quality and control costs through best practices, case studies, and interactive panel discussions led by industry leaders. There will be leaders from states such as Massachusetts, South Carolina, Nebraska, Michigan, Vermont, Ohio, Arkansas, Alabama, health plans such as HealthNet, Cook's Children's, UPMC, AmeriHealth, CareChoice, CareSource, Gunderson Lutheran, BMC, and many, many other industry experts. And because you are a listener of Medicaid Matters, you can get a $200 discount on the conference registration. Just use promotional code MP52 when you register. That's Mike Papa 52. For details, please view the complete agenda and registration information at MedicaidInnovations.com. They also have a very active group on LinkedIn, and I would encourage you to join that group as well. I'm a member myself, and I get a lot of great information just by participating in that group. So why don't you register today, make plans to come by and meet me before or after our live broadcast on February 8th right from the conference. Well, today we're talking with Dan Rizzo, Chief Innovation Officer at MedAssurance, and we're digging into the subject of how Medicaid organizations can best use their data. You know, Dan, a lot of the issues, I think, that come from this subject, that spring up about organizations better using their data, is from the lack of integration across multiple information gathering platforms. Now, if the goal is to use the data to improve quality, to improve outcomes, to better manage the operations, and quite frankly, ultimately help the Medicaid population become healthier, what kind of impact does this silo characteristic have on achieving these goals?
Well, Richard, great question. And before I answer that, I first say really looking forward to the Medicaid Innovations Forum this year. Great venue and one where one can pull out such great nuggets of issues, challenges, and opportunities in virtually every session that is going to happen there. So really looking forward to that.
Great conference, no question.
Yeah, so in terms of silos, we see this so often from in the industry, and this is pervasive across all types of payer entities, Medicare, Medicaid, and commercial. Different departments operate independently, and they don't collaborate with their data. They don't share data. They don't make their data available to others, and ultimately that results in limited insight into the patient and their outcomes. Limited transparency and collaboration amongst groups, and incomplete information to address complex issues. We firmly believe that a comprehensive data collection should be a shared goal amongst all groups within a health plan and their vendors in a way that allows that data to be shared in a responsible manner. There's so many different aspects of a patient's life that we in the industry have access to. We know so much about their medical care through the claims data that we receive. We know so much about how they live their lives through our telephonic care management, coaching. We know so much about what their barriers are. But a lot of the times, we only know that in small pockets. And that type of information, when brought together in a centralized way that can be shared and viewed amongst groups really looking to improve how we serve those patients, is just critical to ultimately driving the improvements that we need. But we have to do so in a way that is responsible, making sure that we understand where data comes from, understand what has been reported by the patient, what has been recorded by his or her provider, and use that data to really help us drive an understanding of how they act and how they respond to their providers and how they utilize services.
A comprehensive data collection system makes so much sense, but it seems that if you're in an organization where this silo, this compartmentalization type of structure has been created, it almost has a momentum in a life of its own. How have you seen other organizations move away from this so that they can get to a more comprehensive data collection system?
No, it's really can be a challenge, but it's one that can be overcome. I think it ultimately starts with data collection and really scrutinizing where are the opportunities in the activities that we all do to collect information about the patient that we're missing today. Are we on our customer service lines collecting the information that can really help us understand the patient's lives? When we're talking to them in our care management activities or case management, are we recording the data in a way that is then analyzable, is then utilized for developing that deeper understanding? So we really have to do some hard work there, go area by area, looking for opportunities to increase our collection. And then once we've established a good framework from that, that data can often be integrated well into health plans' data warehouses, which receive data from many sources today, but not all of the sources that they can. And so I would say there are patterns that are in place for how we can enhance this. But it really is some hard work in sitting down and looking at the areas to improve that collection piece. once the data's there, once it is available in a central place, then it really feeds upon itself. Then we really have people using the data to see and derive new things, new innovations, new areas of interest. But if that data never gets there, then it's our first and immediate barrier, but one that we definitely can overcome.
This is where the strategic link comes in, because so many. This is a huge generalization, but without having the data in front of me to be more accurate, I'm going to make it. So many organizations see this as just a technology or information technology function, and there's a strategic direction for the company, but it's not always mirrored with this whole issue of data collection. Because and let me ask you this question, shouldn't the strategy of the company be driving the data collection system as opposed to let's create a strategy based on the data we have available?
Oh, I couldn't agree more. And I would further say that the strategy should include the concept that we collectively need to know as much about the patients we serve as we can. You know, when we think about a parallel right now, as we're living the holiday season, our credit card companies, the places we buy from, know so much about us. They know what we buy. They know when we buy it. They know our patterns. They know our some information about us that can characterize us. I know that Amazon knows, based upon my profile, that I am going to buy a tablet for some family or friend this year, and gosh darn it, they're right. Now, Apple beat them to the punch. I bought the iPad for my wife. I hope she's not listening. But Amazon was in front of that. They wanted me to buy that Samsung tablet through their website. We can do that in healthcare. But it starts with a strategy. And that concept I've just described is absolutely core to the strategy of Amazon or the credit card companies. And that really is a strategy and a philosophy at MedAssurant, and one we really like to invoke in our clients. The strategy of understand, capture as much as you can about those who you're serving, and then the analytics can flow. And there's lots of great tools that we collectively, the industry, can bring to bear on the data if the data is there and available.
I couldn't agree more with you as well. The credit card companies have got it nailed down. I know the Amazon was a great example. If I buy or download a book from Amazon for the next 3 months, I'm going to be getting suggestions. So if they can do it, we ought to be able to do it in healthcare. There's no question about it.
And further to that, they've continued to learn how best to reach us. Mm-hmm. They know increasingly that we rarely answer the phone at home because they're always sales calls. So they've stopped calling. But they also know that when they send us an email with a special, we respond to that. Mm-hmm. Now, that's just me and my wife. But, others have different profiles. And so it's not just about knowing how, what we like, what we're going to do, how we're going to act, but it's about how we're going to respond. Am I going to respond as a Medicaid patient to, a generic mailing? Am I going to, does that get me to move? Some patients it absolutely does. Yeah. Am I going to answer my home phone? Sometimes. Am I going to answer my cell phone? Am I going to respond to the different stimuluses that we can put out there? And then when I do, am I being told something that makes sense to me? Mm-hmm. And so, again, that's where I think the that industry, the credit card industry, and some of those consumer companies like Amazon have really nailed it. Not just in understanding, what I like, but how I like to interact with them. And we can do that in healthcare too, but we have to record it. Right. When we call a patient, we have to understand. Have we called them 4 times in a row and gotten no answer? Have we? Last time when we talked to them, did we see them? Making an action after we called them. But if that information about our interaction, that call that occurred, the dispositions on that call, the different things we recorded, if that never makes its way into a place that gets paired with the claims data or the other clinical information we have, then we can't do that type of analysis. Mm-hmm. And so we can emulate that template and really ultimately drive tremendous improvement.
Great point. Well, we're going to take a pause here before we start the second half of our show today. So stay with us. There's lots more to come.
You're listening to Medicaid Matters on the blogtalkradio.com network. The Medicaid landscape is changing fast, and that means challenges. But it also means opportunity for you. And that's why you need to visit MedicaidJobs.net. MedicaidJobs.net is the place to showcase your talent to Medicaid companies. Search for jobs, research the latest career trends, and register for the free Career Optimizer service. Don't wait. Go to MedicaidJobs.net today.
Every 19 seconds, a child will die because of a lack of clean water. It is estimated that more than 80% of childhood diseases and deaths in underdeveloped countries are a direct result of drinking contaminated water. During the course of this commercial, 3 children will die. You can help make a difference in the lives of these children. By supporting Healing Hands International, you will provide safe, clean drinking water to families and villages around the world. Since 2006, Healing Hands has drilled more than 400 water wells in countries like Haiti, Ethiopia, Zimbabwe, and Honduras. Through the help of people like you, we have been able to bring the gift of clean water to more than 1 million people. To learn more about Healing Hands International and what we are doing to help, visit www.hhi.org. With your help, we can continue this life-saving work and make a significant difference in the lives of children.
Well, let's get back to our guest, Dan Rizzo, Chief Innovation Officer at MedAssurant, and our topic today, which is putting the data in the driver's seat. Dan, something very important to me and to my company is helping to increase not only the quality of care that Medicaid members receive, but the overall health of the Medicaid population. If anyone's been listening to this show for any length of time, they know that that is something very important to our company. And that's one of the reasons I chose to get involved with the Medicaid business community because of the people they serve. Do you think, Dan, that today Medicaid health plans are collecting all the data that they need to provide truly effective intervention with their plan members?
Well, I think it's certainly improving. I would suggest that there continues to be opportunities to learn and understand more about a patient beyond what the claims data can tell us. And unfortunately, historically, health plans really only interact deeply with a very small subset of patients. But there are opportunities to interact with a broader set of patients to understand some of those intangibles that really can affect how they utilize services, how they interact with the system, understanding their family history, their social history, barriers to care, what their support system is like. Do they live with somebody who is who can help them in managing their care? And so, things that we perhaps underappreciate in terms of the raw clinical data or claims data that really can help round out the picture of the patient. We so often have information that we've seen just not be used as optimally as it could be because it wasn't available. You hate those situations where you see the lack of information driving an impact that affects a patient physically or emotionally. Sending a letter to them because you see the diabetes indications, emphasizing the need to walk or run, and not knowing that, gosh, this patient has an amputation I didn't know about. And that kind of thing is really where we can round out a good set of data we already have, understand some of that information that only lives inside the patient's inside their brain and in their history, and collect it in a way that then is usable for analytics later.
That sounds like a lot of big changes and a big expense for health plans. Is it really? Let me ask you, is it more of a cultural change for the organization, or is it really an entire rework of infrastructure and the way the information is used?
Well, I would say it's more a cultural and strategic change than it is a massive technological change. And the reason I say that is, we here at MedAssurant have seen that over the years. We and our clients, our health plan clients, interact with patients at so many different opportunities and so many different venues. It's really extending those interactions to think about them not only for their primary purpose, but also for a data collection purpose. So we already are talking to patients as they call in to ask questions about their benefits, as they interact with us in various capacities, that we strategically can think about that interaction a little bit differently, not just to answer their question, but in the process to spend another 30 seconds capturing some real important information. Now, no doubt there's a technological change that accompanies that, but that can be managed. Those additional items can be addressed without a major technological infrastructure change, given that we're already on the phone, given that we're already collecting information, answering questions, and addressing their needs. Mm-hmm. So we really have to start, strategically, and then work rationally from there in the areas where it economically is feasible. I would say this does not have to be a boil the ocean type activity. We can strategically make it a goal and prioritize where are the touch points that have the greatest opportunity to add some additional information collection, to feed a data warehouse continually over time, and evolve to a broader collection and thought landscape about how we think about our patients, rather than a one-time event.
Boil the ocean activity. I really like that phrase. I wrote it down. I'm going to use that again. I've not heard that before. Hey, I want to ask you one more question, and then I want to use the rest of our time to talk about the project that you did with that MedAssurant did in conjunction with the Medicaid Health Plans of America. But let me ask you this first. If I'm the CEO of a health plan and I'm listening to this today and I say, this makes a lot of sense, how do I begin to move in that direction, Dan? What are some of the first steps I need to start taking?
Sure. Well, we'll put the obligatory self-serving call MedAssurant. We'll put that one off to the side, and we'll and really it begins with aligning the strategy because as we kind of mentioned early on in the call, the concept of putting data at the forefront, using it increasingly to drive activities is one that needs alignment. Between the strategy, between the technology, and between the operations. We've all been there where we miss one of those three, and the effort doesn't yield the fruit we hoped. So by getting that alignment, by understanding the strategy, articulating it, working then to align operations who are going to be carrying out these activities, the ones using the data, and the technology pieces together is so critical. That's where I would start. Of course, the devil's in the details. There are so many different areas where we can look at the patient health plan interaction today and say how can we do better. But by aligning those three with the right strategy of data collection and then the intention to have that be a foundation for then a further analytical deep understanding of the patient is really I think where we see the most success occurring, getting that foundation of strategy, ops, and technology right.
Now, this time last year, almost to the day, MedAssurant and Medicaid Health Plans of America announced a partnership to use your resources to really get their arms around some pressing health issues in the Medicaid population. At the center of this is what you call the MORE registry. Could you tell us a little bit about this?
Yeah, certainly. In our capacity of working with health plans all over the country, we have built a proprietary de-identified data set that really helps us inform our products and inform our clients. This data set, the MORE Squared Registry, stands for Medical Outcomes Research for Effectiveness and Economics. The MORE Squared Registry is a data set of about 77 million patients, about 5.2 billion medical events. And this data set is used in a variety of ways. We have in it information about the encounters that patients are having, the diagnoses, the procedures, the drugs interactions, the laboratory results, a whole host of health plan de-identified administrative data that at large scale can drive tremendous insights into the problems that our industry faces today, both at an organization level and at an individual patient level. And so we've brought that data set to bear in partnership with the Medicaid Health Plans of America.
Now, in the partnership, I know you looked at one particular aspect, which I believe was pregnancy, or maternity. Is that correct?
It is. Yep.
All right, so tell us a little bit about the scope of that project, and the second part of my question is, how is that information being used to help the Medicaid population?
Sure. Yeah. I would start by actually addressing the second part of your question, and that is really supporting the mission of MHPA to develop and advance public policy that focuses on controlling costs and improving access and delivery of care to Medicaid members. MHPA has started a Center for Best Practices, which really is focused on promoting best practices in clinical and operational areas. They're taking a very data-driven approach to their mission. And with us, happy to partner to drive those improvements. So we started the relationship about a year ago. We're doing a number of different studies driven by the Center for Best Practices. And at first we started to really just look at the Medicaid population and characterize that population based upon the data in the Moore Squared Registry. We have about 37 million patients in the Moore Squared Registry covered by Medicaid benefits. And in that, look to start by with them understanding what that population looks like, which conditions were prevalent above the rest of the population, respiratory disorders like asthma, COPD, almost double the rate of a non-Medicaid population. Looked at emergency room visits and the increasing utilization of urgent care facilities, up 74% from 06 to 09. So that was our starting point. From there, we've then focused on particularly pregnancies and birth-related outcomes. The most common complication being earlier threatened labor. 37% of pregnant women in the study period, which was 2009, showed conditions of earlier threatened labor, which is really problematic, of course, given that the implications and costs of preterm births are so significant. March of Dimes reported that preterm births cost about $64,000, and according to our data, about half of those women that were diagnosed or threatened with.
All right, well, we're almost out of time here. Before we go, though, I have a couple of things I wanted to mention to you. If you like what you heard there from Dan, you'll know that you can hear that entire interview replayed in our archives. Just go to MedicaidTalk.com, search through there, and you'll see a video and audio playback of that entire conversation with Dan Rizzo. I think you'll see it's a very rich conversation in terms of some forward-thinking ways to handle Medicaid data, both from a collection standpoint as well as from a standpoint of how to structure the data and how to use data really in the sense of a strategy for your company, not just an IT function. This was probably echoed over and over again at the Medicaid Enterprise Systems Conference a few weeks ago, both by state agencies, by private companies, by vendors, and certainly by CMS representatives that were there. All of those groups had a tremendously powerful collaborative presence in not just presentations, but as you often know at conferences, the side conversations, a whole lot more gets done in those than in sometimes just in the presentations themselves. So it was very good to hear that going on. So a lot is going on right now with MMIS, and it has to be, because within that data, as Dan was talking about in that replay, within that data is a gold mine of information that is going to be very, very helpful for all of Medicaid moving forward. Well, we're just about out of time here in the last couple of minutes. I hope you enjoyed today's show. But again, go to our archives and you can catch all that Dan had to talk about, and that is at MedicaidTalk.com. We're going to be back on September 18th at 1 p.m. Eastern Time with Dr. Michael Camaro. He is the medical director for Care to Care, and he and I are going to be talking about utilization in the eye of health reform, a new way of looking at some things that I think you're going to want to hear about that. If you want to keep up to date on all the things that are going on with Medicaid Matters, just go to MedicaidTalk.com
60 seconds.
and you can register for our blog. And whenever something new happens with the show or with our company, you're going to be sure to find out about it. So do that today, especially if you're on the page right now. Just go up and put your email address in. It's pretty easy to do. Well, this is Medicaid Matters. It's brought to you by Managed Medicaid Services. Today is Tuesday, September 4th, 2012, and this is your host, Richard Yadon. We're going to be talking Medicaid again with you in 2 weeks. Until then, I hope you have a great day. Thanks for joining us.
Ten seconds.